How does a colon biopsy identify benign versus malignant polyps? Imagine you're having a routine colonoscopy and a polyp is found. The question is it harmless or could it be cancer? That's where a colon biopsy comes into play. During the procedure, the doctor might remove a small piece of the polyp tissue to examine it closely. This tissue is then sent to a lab where a pathologist looks at it under a microscope. The goal is to see how the cells look and behave. Benign polyps, like hyperplastic polyps, usually have normal-looking cells that don't show signs of abnormal growth. They don't invade surrounding tissues and are generally not a threat for cancer. On the other hand, malignant polyps contain cancerous cells that have started to invade deeper layers or nearby tissues. These cells often look irregular, with abnormal shapes and sizes, and may show high-grade dysplasia, which is a sign of precancerous change. Pathologists use specific classification systems to tell the difference. They look for cellular architecture, such as how the cells are organized, and whether there is invasion of tissue. For example, adenomatous polyps can have dysplasia, which can be low or high grade. High-grade dysplasia is more concerning because it indicates a higher risk of turning into cancer. If cancer cells are found invading the tissue, the polyp is classified as malignant. Advanced endoscopic techniques like narrowband imaging or chromoendoscopy help doctors see surface patterns and blood vessels more clearly during the procedure. These tools can sometimes help determine if a polyp looks suspicious enough to warrant a biopsy, but the microscopic examination remains the most reliable way to tell if a polyp is benign or malignant. The results of the biopsy are crucial for deciding what to do next. If the polyp is benign, it might just need to be removed and monitored. If it's precancerous or cancerous, further treatment or surgery could be necessary. Regular follow-up colonoscopies are often recommended for patients with polyps to catch any new growths early. In summary, a colon biopsy identifies whether a polyp is benign or malignant by examining tissue samples under a microscope. It looks for cellular abnormalities, signs of dysplasia, and evidence of invasion. This process helps doctors make accurate diagnoses, guide treatment, and work toward preventing colorectal cancer. Always remember, if you have concerns about colon health, consult with a healthcare professional who can provide personalized advice based on your medical history.